Remember when we were young and we used to write our crushes' names on the tops of our papers or your notebooks? It was always females. It was always girls' names, and I never thought anything different of it.
Malia Lowell of Cheektowaga has spent most of her life knowing and accepting that she's a member of the LGBTQ+ community.
I started telling my friends and everything that this is how I was, this is what I was.
But the people around her were not as accepting.
6th grade is when I started to get bullied, and all of that bullying and not being accepted by my peers and everything is what really started to trigger me as an individual and questioning my worth.
At the tender age of 11, Malia started self-harming. Years later, she would attempt suicide.
LGBTQ youth are 2.5 times more likely to self-harm after every time they experience some sort of victimization, which would include like physical or verbal abuse. Those that are actually rejected by their families are 8 times more likely to attempt suicide.
Robert Rausch is the executive director of GLIS Western New York, a youth support group for LGBT teens.
We've been, growing and learning and morphing with this issue for almost 2 generations now.
According to Rausch, 40% of teens who are homeless in Western New York identify as members of the LGBTQ+ community.
Now, only about 8 to 11% of the youth population would be considered to identify as LGBTQ, so that's far, far out of whack.
When it comes to inpatient mental health care for teens, Rausch says the Child Psychiatric Center in West Seneca reports up to 80% of its patients being a part of the community as well.
There's still not very good statistics.
Over the last few years, Malia, in conjunction with GLIS, have traveled to many different schools in Western New York to talk about mental health to LGBT teens.
It's just really important for these kids to know that they are loved and they are seen and they are appreciated. We are giving these kids a sense of hope to realize that they do have a future and they can be successful because look at us.
And according to Malia, the message is resonating. Surveys from schools she visits show the number of students who have considered dying by suicide has declined from 33% to 14%.
Which, if the number's not 0, we still have a lot of work to do. However, it still makes a very significant difference.
If you identify as an LGBTQ+ teen and are looking for support, you'll find a list of resources at WKBW.com. In Buffalo, Jetty Johnson, 7 Eyewitness News.
If you are dealing with a mental health crisis, there is always help available. Erie County Crisis Services can be reached at 834-3131. In Niagara County, the number is 285-3515. We have all that information and much more on our website, WKBW.com.